Without measurements, with and without color. Left ovary, with and without color, with and without measurements. Yolk sac, where's that gonna be? Yeah, inside the gestational sac, and the gestational sac is where? The fundal endometrium. Fundal endometrium. Okay? Now, it's not gonna be midline, because as soon as it lands and attaches itself, it's gonna start burrowing down. If you see a gestational sac midline, you have an ectopic pregnancy. That's called a pseudo-gestational sac. Okay, a pseudo-gestational sac. If it is midline, okay? The corpus luteum is gonna be on either or of the ovaries, okay? That's with and without color, with and without measurements. The gestational sac, with and without color, with and without measurements, okay? The heart rate, the right adnexa, the left adnexa. The only thing he forgot was the crown rumpling.
Oh.
Okay, with and without measurements, with and without color. Okay, the heart rate. The heart rate is done with M mode. It's less energy to the baby. Okay? Abdominal circumference. How is this baby vertex or is this baby breech?
Breech.
It's cephalic.
I'm picturing.
Spine's up. Stomach's on left side. Here's my stomach. The baby's laying like this. Ooh, that was dizzy.
I was picturing the
I think my baby is gone. Okay, that's right. Because you want your stomach.
Left side.
And what is this? That's the umbilical cord meeting up with the portal system. Okay? That's what it is. So this is perfect. You include the skin. Okay? Right underneath the skin, sometimes it we'll play like this is a skin, and then you'll have a hypoechoic ring right underneath this. This is not ascites, okay? It's pseudo-ascites, okay? And you'll see it all the way around, okay? It's just the muscle under the skin during development. It'll be a hypoechoic ring. And some sonographers will get it confused with ascites. Okay? So, did she get this right? No. No. She included the growth plate. You don't go the growth plate. It's gonna look like this. Okay? Here's a growth plate, here's a growth plate. You measure from here to here.
Oh.
Okay? Do not include the growth plate.
Inside.
Okay? If you come down here and you see an epiphyseal, little dots, this baby's greater than 8 months, especially the distal epiphysis. Okay? If you see this, we know that baby's greater than 8 months. Okay. What shape of head did she give this baby?
Egg.
Huh?
These egg shape.
A brachycephalic. Okay? She made the baby older. She made the baby younger.
Mm.
Okay? She made the baby older and younger. Okay? So, here's the shape of the head, my midline falx, my cavum septum pellucidum, occipital frontal diameter. Okay? Occipital frontal diameter. This is the level you want to be. This is the CSP, cavum septum pellucidum. Okay? Cavum septum pellucidum.
Michelle, when you're trying to get the BPD and the OFD, does that need to be like a perfect circle?
It's not a circle, because if it's a circle, it's a brachycephalic. It's kind of oblong shaped.
It's hard to kind of get when you're,
Yeah.
skin.
It is, but you're gonna get it, because you're just now learning it for 2 weeks. So you're gonna get better. Now, sometimes you can have these little double lines on the inside. You're too far down into the head. Come up out of it a little bit, because you don't want to see those double parallel lines. Okay? Femur length, BPD, outer to inner, OFD, outer to outer, TAD, which one's that? Yeah, TAD. This is your TAD, TAD, and this is your APD. Anterior, posterior diameter, transverse abdominal diameter. Okay, this is what you want to see in the image. If you see kidneys, you need to come up. You're too low. If you see bladder, you need to come up. You're too low. You never want to see kidneys or bladder. Okay?
What about the base of the heart? You don't want to get that high or to diaphragm?
No, you don't want to see, because the heart's even higher than the kidneys. So you want to be, you don't want to have the umbilicus. You don't want to have the umbilicus. You're too low. Okay? You want it to be clear. Okay? Now, other views that you have to do. Stomach. You can use the same image, just take the calipers off, change your annotation, stomach. Okay, so that's gonna cut down on the speed of your exam. Kids. If I'm here, my next move is going to go kids. And I've got my kids. Okay? The next one is cord insertion. I'm moving down. There's my fetal cord insertion. See, I'm still in transverse. I'm just working myself up and down. How I do mine, I do all my measurements together. Okay? I do all my heads together, I do all my abdomens together, I do all my femurs together. Okay? So, stomach, kids, cord insertion, bladder. I'm gonna go below this, and I'm gonna show my bladder. Okay?
We're in transverse, right?
I'm in transverse because I still have my spine up there. Okay, so I've got bladder. If you have a very young baby, there's not enough jelly or cushion in the cord. So you can go and I don't have a red. Do I have a red? I do. And if you see that, we can call that a 3-vessel cord. A 3-vessel cord. That's for very, very young babies. Because as the umbilical cord is forming, an umbilical cord in transverse, oops, I put the wrong one down. An umbilical cord looks like this. Or you can do it like this. Okay? Now the covering of the umbilical cord is amnion. Okay? The cover of the cord. This stuff, the homogeneous stuffing, like a hot dog, is called Wharton's jelly. Wharton's jelly. With a baby, you have 2 arteries and 1 vein. The arteries are O2 depleted. The vein is O2 full. Okay, because it's fetal circulation. So now the arteries are carrying venous blood and the veins are carrying arterial blood because we're in fetal circulation. Okay? So which one is this? It's the larger.
Vein.
That's going to be my vein. This is going to be an artery. And this is going to be an artery. Okay? If you see this, stop what you're doing and go get a senior sonographer. There's something wrong with that baby. There's congenital abnormalities that you're not ready for yet.
So you mean if you see only one artery?
If you only see one artery, stop what you're doing and go get a senior sonographer because there's something wrong with this baby.
That's the abdominal area?
Huh?
The abdominal area? Where is that?
The umbilical cord.
Oh,
It's just the cord.
the tricep.
If we're seeing it when ordering, what type of congenital abnormality?
We're gonna get to that later on. It's way over what you're ready for. Okay.
What will affect this case if there is just one vein and one artery?
Yes? What about it?
You said this is for genital, you are not ready for.
Go get someone, you're not ready for this yet.
I saw that
Mhm.
the sonographer, she
Mhm.
go and get the doctor.
Correct. You're not ready for it. So if you see this, immediately stop what you're doing and go get a sonographer. You're not ready for that exam yet.
To differentiate organ
The vein?
from a vein. You have to do the power Doppler.
We don't like to use power Doppler if we don't have to. If you get it in transverse, because the umbilical cord, the arteries and veins coil. If they coil one way, it's normal. If they coil the other way, it's abnormal. Okay? You never want to use power color unless you have to, especially in the first trimester. Okay, so in the first trimester, am I even going to try to get a 3-vessel cord? No.
You just do the
This
power
is all I
Doppler.
do for a first trimester. Okay? And a first trimester is from 0 to 13 weeks, 6 days. Okay? Once it's 14 to 26 is the second trimester. 27 to 40, it's third trimester. 40 to 42, it's
Final.
14 or 26.
it's got a name, I can't remember it. It's post dates. Okay? It's got a name, I can't remember it. Okay?
Full term? Is it full term?
I'm sorry?
Full term?
No, it's past full term. It's got a name. I can't remember it. Okay, and then a 3-vessel port. Okay. You're also has to do the cervix. That's gonna be your very first shot is the cervix, and it has to be greater than 3.5 cm. Okay? 3.5 cm. Then you do placenta, sagittal, transverse, and placenta cord insertion. Placental cord insertion. Then you have to do your AFI. You do your right upper quadrant, right lower quadrant, left upper quadrant, left lower quadrant. You can do it in sagittal or transverse. It doesn't matter, but not both. It has to be exactly the same. I'm not gonna do one sagittal, one transverse. Your transducer has to be parallel to the bed. You can't be angling in to the baby. You have to keep it parallel. Okay? The AFI has to be greater than 8 cm and less than, I think it's 20 cm. Might be 22. Stomach, kids, cord insertion, femur length. Then you need a 4-chamber heart. Here's an atria, a ventricle, a ventricle. Huh?
No, which term we do all this? First term?
No, first term, you're not gonna see the heart. Second and third trimester is what we're talking about. Okay? Now, when you do your M mode for your heart rate, you're gonna get your 4-chamber heart. There's a leaflet here. There's a leaflet here. Okay? You want to put your sample volume on that leaflet. Okay? Your sample volume on that leaflet. There's some more things. Let's talk about the heart.
So that's the location you get the measurement of the heart?
Heart rate
Yeah.
at the 4-chamber heart. Good job, Dewey.
I win. What?
Okay. Later on, you're gonna have to learn how to do RVOT and LVOT. RVOT and LVOT. Okay? Right ventricular outflow tract. Left ventricular outflow tract. The right empties into the lungs. The left leaves the lungs and goes to the left ventricle. Fetal circulation. Okay, I'm going to show you a trick for RVOT and LVOT. You can practice it, but you don't have to have it yet. Okay? Here's my 4-chamber heart. Atria, ventricle, ventricle. Okay? If I elongate my atria, the RVOT comes from the right atria. It opens up the atria going into the lungs. So if I'm at 4-chamber, if I go counterclockwise and I get right, then I have to go clockwise and I get left. If you get lost, go back to the 4-chamber view.